Lack of confidence is a major problem among GP registrars sitting the RCA. This can be translated in taking a long time in data gathering, asking all sorts of questions to avoid missing things, not committing to working diagnosis, and rushing through clinical management. Not too long ago, I had a chat with a GP registrar who had a lot of issues with low confidence. She was also diagnosed with dyslexia, which made it more difficult for her to prepare for the RCA. She had many doubts whether she would be able to pass the RCA. In this video, you're going to hear from Dr. Hannah Fels, GP registrar who recently passed the RCA, and she's going to talk about how she built her confidence despite having dyslexia.
I think I found it quite overwhelming. I really struggled listening back to myself. I think a lot of people have that fear as well, especially as medics. We want to be saying the right things and doing the right things, and it's amazing the things you hear yourself say or suggest when you're watching yourself back. So I really just didn't think this was a hurdle that I was going to be able to get over. I thought if I had 15 minutes, then maybe it was more achievable. But I think I really struggled to see myself as the doctor. I think throughout my training, you've always had a senior, you're always a trainee. And actually this exam, one of the things I really had to learn was actually this exam is not just another exam to get it through because I have to. It's an exam to actually let me be licensed as a GP, and I had to really see it as something that was going to give me another step up in my career. And it's I really did have, you're right, mindset. I really had to shift into that. Actually, this could be me in a few months' time on my own with this patient. So actually, I need to take responsibility for my learning and knowing the management plans, where to look for resources and things.
Right. So that shift in mindset helped you. Could you tell us what are the things that you've done to help build your confidence? Because it's very difficult coming from a place where you're not confident about your management and how you consult, and then to actually do it and then be able to get cases that are level to what we're expecting for a clear pass.
So one of the things I probably should have mentioned in my preparation was I decided to explore different courses for the preparation. I just knew I needed to use my time efficiently, and that was where I came across your one-to-one coaching, which I think was a real, it first highlighted the confidence issue, I think. And I decided to try and get the mandatory cases first, because I felt that would give me a bit of a confidence boost if I knew that the ones I have to submit I had some consultations like that. Then I felt like I'd be moving forward, rather than it can be very disappointing to keep doing recording after recording and thinking, no, I can't use this, I can't use this, I can't use this. So I also did give myself some breaks of recording, and it was really nice to see follow-up patients because then you knew the pressure would be off. I'm just trying to think what else. Yeah, I think those are the main things, really just trying to focus on the mandatory criteria. And to be honest, I actually ended up using cases from those topics as my extra cases. Something you mentioned, actually, I don't know if it was on your course or in our coaching, about trying to maybe do a topic a week or something, see a run of chest pains or see a run of headaches. This really, really helped me. It wasn't possible for me to orchestrate that, but I found I almost did that with the mandatory cases. So I became so much more confident with mental health, with women's health, because I was talking about HRT until I was blue in the face. And I think you just get a bit more comfortable and confident, and things just roll a bit smoother. So I think this is a very long-winded way of saying exposure, seeing more patients, talking through things, and away from that, thinking about how you're saying things. I actually had crib sheets for myself, possibly because of the dyslexia, but to literally read. At the beginning, I was sort of reading off, but as time went on, it was just much more natural.
If you found this video useful and you'd like to watch the whole interview, then click the video here. Take care, everybody. Bye-bye.